Hi, how are you? How's everybody doing today? Hope you're all doing well and staying pain free. Today, I want to talk about a little bit about the ankylosing spondylitis and the heart condition. Um, Autoimmune conditions like such as ankylosing spondylitis and rheumatoid arthritis has a very close relation with some of the heart conditions. So uh, let's talk about that. A little disclaimer. Um, Everything I talked about are pretty much conditions that I have experienced and conditions that I'm seeing a doctor for, informations that I got from my doctor and online. I am not a medical professional, so if you have any medical concerns, medical questions, please address that to your doctor. Thank you. So, just ankylosing spondylitis itself and rheumatoid arthritis, the two are bad enough, it's severe enough to cause a tremendous amount of damage to, the individual on their joints and hips and spines and ankles, whatever any kind of joint that they like, that this disease just like to attack these joints, and it could be very disabling. But it doesn't really stop there. Um, we all know ankylosing spondylitis itself can cause a number of conditions, more than just, your own spines and other stuff. Um, in this particular diagram, it can create all kinds of issues, uveitis, inflammation of the eye. Uh, Depressions is when somebody who has pain and all that, you go into depression mode, and I have been there many many times. Um, One of the really big problem, it can cause heart issues, and I am seeing a doctor, a cardiologist, for that particular reason. My cardiologist keeps a close eye on my heart, um, just to make sure that the inflammation will not cause any of the problems that can affect it, and many other different condition, osteoporosis and all that other stuff, are part of the ankylosing spondylitis. But today I want to focus on the heart problems. Now it can cause a number of heart conditions, not just one, but many other conditions. And inflammation itself, it's pretty bad. It can cause all kinds of conditions of your heart. The big issue that my doctor is really concerned about is called the aortitis, which is an inflammation of the aorta. The aorta is the biggest artery, um, the biggest blood artery that's feeding the blood to the rest of your body. Um, if you look at the diagram here, this part is your aorta. So as you can see, this picture is from Cleveland Clinics, and it can affect this particular the aorta valve. When the aorta valve is messed up, it needs to be repaired. And when you have a inflated with inflammations in the aorta, it can limit the amount of blood flows, and it can cause all kinds of problems. And when you don't have enough blood floating in your body, other part of the body starts having issues. So that is the biggest thing that in from what I know that my doctor is concerned about. He checks my aorta all the time. So symptoms of with the if you have inflammation on the aorta, symptoms can be things like chest pain, short of breath, dizziness, all the classic heart condition symptoms. Nauseas and all that stuff. Treatment is really to reduce the inflammation. Of course, the rheumatologist generally takes care of the medications for your ankylosing spondylitis, and it could be non-steroid anti-inflammatory drugs, or steroids, or even biologics. And biologic works on the immune system when these are autoimmune conditions. So when you lower the immune system, automatically your body will stop attacking your own tissues. And then with some other additional medications, you can bring the inflammations down. So the other condition it can cause is electricity disturbance. And when that happens, you have your arrhythmias, palpitations. Sometimes your heart rate can go really fast, tachycardia, or suddenly, you felt a low heartbeat and you feel like you have no energy. And then, you can check your pulse, it's beating very slow. Bradycardia. These are electrical disturbance. I had palpitations before, and pretty much it's more of it's PVC, premature ventricular um, something. What does PVC stand for? I forgot. Anyway, it's called PVC. So I, I I end up being getting on medications and ablation. I'll talk about it in just a second. Many of these symptoms are very classic heart condition symptoms: chest pain, lightheaded, short of breath, dizziness, and all that stuff is the same as with the arrhythmia. I remember when I had these PVCs, um, my energy level was just not there. Uh, I felt like I just couldn't get enough energy to do things, because my heartbeat was just not normal. It was skipping every other beat, and it goes on for hours. Or the longest I had was like I think it was like a couple of days nonstop, and I was just it was so fatigued that I can't do anything. If you feel the heartbeats, um, it felt really weird. It's just really, really, really weird and very scary. So treatments, from what I remember, is doctor gave me beta blocker. Beta blocker can actually takes away some of the PVCs in the body, um, but it also slows down the heart. It's not good to be on beta blocker for slow heartbeat. When you have tachycardia, the fast heartbeat, it works great. Beta blockers. And generally, medication would be, of course, it's always the first line of treatment for anything. If medications fail for the electricity disturbance, then ablation, the cardiac ablation is I believe the cardiac ablations now is the gold standard treatment for arrhythmias, regardless if it's tachycardia or bradycardia. And when there's a disturbance in the heart rhythm, the electricals, um, they stick some wires into your heart, generally coming up from your groin all the way up into the heart, and they can find these where the disturbance are within the heart, and then they burn that section to correct the disturbance. And once that's corrected, your heartbeat just comes back normally. It's so a miracle that nowadays, and how much science has improved. Um, I noticed that a hospital in LA, Cedar Sinai, they are very, very specialized in doing that kind of surgery, and they have, I mean, they have like I believe over 10 surgical room just dedicated for that type of surgery. So once that is corrected, you can even be off of the medications, and your heart will just be normal as it never happened. But some people, as far as I know from what I heard, is the doctor said there are some people that will probably require uh, multiple ablations because some things can come back. Certain people have conditions, and even if you correct that, it'll come back, and then you just have to redo it again. And if you look at the image down here, these are the wires I was talking about. And then if they found an issue in this area, then they just send some kind of signal or electricity to just burn out that little tissues over there, and your heart will be back to normal. So, but in a severe case where, say, medication failed or ablation did not work, I believe I actually know somebody who is, having some issues right now. He did a couple of ablations and some cardio version where they just did some electricity shock to the heart, not defibrillator, but just a different type of electrical shock. Um, it'll fix him for a couple months, and then it'll come back real quick, and his heartbeat starts going really quick. Um, and then ovulation did the same. It'll come back in about a few months, and it's happening again. And for people who have these conditions, who medication actually don't work, and the ovulation did not work, and the best thing to secure their safety is to uh, implant a ICD, a a device, a small enough device that looks like a pacemaker, put it under the skin with some wires to the heart. And when that device picks up dangerous rhythms or too slow, it'll kick in and normalize the heartbeat again to keep the person safe. Some of these conditions can be quite dangerous, and that is in more of a severe cases. Ischemic heart disease can be one of them that's caused by the inflammation. The condition where a person can reduce his blood flow to the heart muscles and the tissues, and this is the part that where uh, a lot of people worry about having the heart attack. Yeah, this is what it is when you don't have enough blood feeding into your heart muscles, into your cells. Don't have enough cells to beat to produce the heartbeats. That's when it has problem with the heart, can actually stop working, and that's what you call a heart attack. Symptoms again with these are anginas, which chest pain. Uh, Chest pressure is more like your chest has been crushed by something. I felt these before. It's not because I was having a heart attack. A lot of the issues can mimic heart conditions, so I felt these before. Anxiety itself can actually mimic the condition. Um, Unable to exercise because when you're trying to do things, you just get really fatigued. Um, Even normal daily activities, you don't have any energy. You cannot get out there on walk and do things. You just don't feel like doing anything at all. So treatments for these, generally when you don't have enough blood going into your heart muscles, there must be a artery that might be blocked, or uh, at least a certain amount of percentage that's blocked. Doctor generally will start you off on some blood thinner if it's not really severe, they'll put you on a block thinner, blood pressure medication and a blood thinner. So the you thin your blood and the blood floats a little bit easier. And then they'll do an angiogram on you to see how many percentage the artery is blocked, and they'll determine whether they need to, do a quick surgery on you or just monitor you. From what I heard, is they don't do anything. Even the artery is about 90 percentage blocked, but I could be wrong. Don't take my word for it. Just from what I heard, my friend had some issues. They have to do an immediate surgery on him, and they put a they what they did is called angioplasty. So what they do is they put some kind of a stent inside, so it's like a little straw. Just open up the artery and let the blood flow uh, normally. So there's also the other way is you do a coronary bypass, and you take some um, arteries from elsewhere and replace it with the one on your heart to get the blood floating again. These are to fix your the people who is about to have a heart attack. And yeah, all these heart conditions, it can be caused by people like us who's having ankylosing spondylitis or rheumatoid arthritis. The inflammation is bad. The inflammation in the body is bad. So um, we need to reduce that um, as much as possible and as soon as possible, so it doesn't get to the point that where you know things can these can cause more problems to other part of the body, including the heart. These information that I actually found, or uh, from my doctor telling me about the aorta and all that stuff, as well as you can find all these information on this website here. It'll tell you all the description about how the ankylosing spondylitis can possibly cause these particular issues. And of course, it's a rare condition. I mean, not everybody's going to have it, but for us who is having ankylosing spondylitis and rheumatoid arthritis, we have a much greater chance of developing these conditions. Now, as for myself, I currently do not have any heart issue that's caused by the ankylosing spondylitis and inflammation. My inflammation currently is very much under control, um, so that's good. But I did have, again, I mentioned it earlier, I did have palpitations earlier. It's due to something else. It might just be there might just be some electrical disturbance, or it was coming from my anxiety. My heart was skipping a beat every other beat. So I was having PVCs, uh, premature ventricular contraction. That's it. So I I was on medication. It didn't really fix it, and I actually end up I have to do a cardiac ablation. It took 3 attempts in 3 different hospitals with 3 sets of different doctors to be able to find the location, and they ablated that area, and my heartbeat was being just perfectly fine. The weirdest thing is every single time, it was not consistent. Every single time when I go into see the doctor, or when I go into surgery, my heart was perfectly fine. It was beating perfectly fine. There was no PVCs. The doctor had tried pumping medications in me, speeding up my heart, or slowing down my heart. It did not show up. So there was 2 attempts that we went in there. Um, the wires actually went from my groin up to my heart, uh, twice getting ready to, you know, ovulate when they find the faulty electrical area. But over the 2-3 hour span, nothing. So we end up just the doctor just end up call it a day, and I went home without getting the procedure done. But the they still have to open up the hole in my groin, and I have to stay in the hospital overnight for monitoring. So these autoimmune diseases that we have, the ankylosing spondylitis, the rheumatoid arthritis, and other conditions like scoliosis, these can all cause heart conditions. Um, and my doctor again, my cardiologist keeps a close eye on me. He does an echo on my heart every year to make sure that my aorta is not having inflammation. Um, it's not having a low blood flow to the other part of the body. So if you have the right doctor, and we all know again ankylosing spondylitis with all these particular issues, when you get the right doctor to manage your condition, we all can live just a normal life like everybody else. So we want to, the key plan again, the key plan and the game plan is to uh, catch these in the early stage, in the early days, and hopefully not let it progress to a point where we need uh, surgeries and anything else. So yeah, if you do notice that you are having some kind of chest pain, short of breath, and you're just not feeling right in your chest, you just notice you're not having the energy level. I do suggest you go see a cardiologist and make sure you get your heart checked out, and keep that doctor. Go see the doctor every 6 months or at least once a year, just to do a follow up, make sure that everything is okay. And I do that I follow up with my doctor, with my cardiologist every 6 months, and I have multiple multiple cardiologists as well. I did a bunch of other tests like stress tests, echoes, and EKG, ECG, if you will, um, all that to make sure that the heart is normal. Nothing is wrong. Getting the echo, X-ray, making sure that your arteries okay, your aorta is okay. So keep doing your exercise, keep enjoying your life, and don't let anything stop you from having the life that you want. So anyway, that's all for my video for today. It's just a little bit of information that I got from my doctor, and a little information I did research on the internet. In regards to ankylosing spondylitis, has a good relation with the heart. So we want to make sure that we want to keep ourselves healthy, and we all wanted to know these conditions ahead of time. So again, if you do uh, think that you have these conditions, please go see a doctor. Get your heart ruled out, that your heart is in great condition, and then have a doctor monitor your condition every few months. Once a year or so. Take some pictures, make sure you're in good shape. So anyway, that's all for the video. Thank you for watching. If you have any information you want to share with me, I would love to hear from you. It's just a little something that a little information that I have learned from my doctors, and hopefully I want to share with everybody else. We can all learn from each other, and then we can all find these better days together. So again, thank you for watching. If you like my videos, please give me a like. If you want to subscribe, please do so. I'll have more videos coming out in the future about other things. So again, thank you so much. Have a nice day. Take care. Bye-bye.